Hi, I'd like to discuss with you the potential for using medications and for using it to maintain your hair in the long run. A lot of patients come to me concerned about having to take medications their whole life, and I can understand that. As a young person, you'd rather not have to take a medication that could potentially cause changes, side effects, just the costs of it, and having to do it over your lifetime. But I want you to consider, which I tell my patients to consider all the time, is down the road, say 10, 20 years down the road, you have to think about where your hair is going to be then. Because right now you may have just a little bit of loss in the corners or the back, and you may think, oh, it can't get any worse, I just want it to be better. But you have to imagine yourself 10, 20 years down the road where you lose even more hair. And so the goal of medications is not really to regrow hair, and although sometimes it's nice, but really to maintain what you have. And I think if you can get on a medication that's very inexpensive, very easy to take, convenient, no side effects, and you can maintain that hair for many years, I think it's doing you a great service. And that's what I want you to consider when thinking about medications. Patients would say, I don't want to take this medication because I can't believe I have to take it my whole life. I just think it's... So I kind of tie this analogy into it. You brush your teeth every day, twice a day hopefully sometimes, and you spend 2-3 minutes each time brushing your teeth. You don't see much difference. 10, 20 years down the road, you're still brushing your teeth, and then all of a sudden you decide to stop brushing your teeth. What's going to happen? You're going to lose your teeth. They're going to fall out. So it's kind of a maintenance medication or treatment brushing your teeth is. I kind of say the same thing with preventative medications with minoxidil and Propecia. Those are things you take over the years. You may not see much, but once you stop, you start losing hair. And you have to think about it in those ways. And I think if you do, it makes a lot of sense to get on medications. Especially if you're considering surgery. You're doing surgery in a certain area to enhance that area or improve that area. Medications are going to help preserve the hair around it and behind it. And the goal would be to lock in those areas of native hair. And so I believe the combination of medications and surgery for most patients is typically the best treatment that you could think of. Now, some patients may not be able to take one medication or another, and that's fine. Thankfully, we have a few options available, and we can tailor it to you and to them. And so I do ask you to kind of consider that during your walk and discovery of hair loss treatments. Thank you.